All right, we're going back into patient-provider communication, so let's talk about some interactions. So we've talked about power differences a little bit, but power differences in interaction, power is inherent in the patient-provider interaction, meaning there's going to be a power differential. Sometimes it's good, sometimes it's not. Sometimes your doctor uses their power differential for good. Sometimes they use it as a way to let others know that they know more than them. We talked about communication accommodation theory, so interactants adjust to the communication behavior of each other, and they can manage power differences or accidentally create them. But there's also uncertainty within the patient-provider interactions. We don't know how the patient's going to act, how the provider is going to act. We don't know what's going to come of this interaction. And patients can also be activated and empowered, right? So patient activation and empowerment. And we will talk about each of those a little bit more in depth here in a second. So uncertainty in healthcare. There's uncertainty about the provider, uncertainty about the illness and treatment outcomes, and uncertainty about your disease and illness. Because remember, disease and illness are two different things. With patient-provider interactions, the uncertainty causes anxiety and worry, and that might actually cause more fear. So we want to try and manage our uncertainty. Traditionally, this is viewed as always wanted. We always want to reduce uncertainty, but some people like a small amount of uncertainty. So with uncertainty management, we seek out new information. This helps reduce our uncertainty about certain things, but it also might increase because we might not fully understand what's going on. And therefore, we might not reduce our uncertainty. So we also, on the flip side, avoid new information. I don't want to further know about this. I don't want to get caught up in this. Uncertainty management. So we reassess information about the illness and the source of information. Maybe it's not that bad, so we reassess the information about the illness and the source. Maybe the source, your provider, doesn't know what they're talking about, right? This is how we get through reassessing. With uncertainty management, we look for and we want information on our illness and our providers. How many of you have, I don't mean physician shopped in a bad way, but you've looked around, you've decided what type of physician you would like just based on, what their reviews are online. We're seeking out new information on our providers. By not knowing the amount of information we want to know can also make us worry. So do we know too little? Do we know too much? And then meeting our uncertainty needs is tied to satisfaction with healthcare. If they can reduce our uncertainties without creating new uncertainties, we might be more satisfied, we will be more satisfied with our healthcare and our service. With uncertainty management, though, unfortunately, answers are not always available. Patients have to be encouraged to reassess their uncertainty and their expectations. So providers can help with this. Patients also need coping skills for this, right? So we can't tell you what disease you have. We don't know. We can keep trying to look, though. So patients should reassess their uncertainty and their expectations. I expect that my doctor finds out what's wrong with me, right? Our provider can help with that, of course. But I also need the coping skills necessary to get through whatever it is. So with uncertainty management, how do we choose a new provider? Why do we stay with certain providers? Well, this is patient activation. That's the whole point of it. So it's like patient empowerment in our textbook. When a patient is willing and able to identify, willing and able to independently manage their care, it's similar to self-efficacy. Can they make the behavior changes necessary? Yes. They also have the knowledge about their own experience. They can share it openly. And they can connect it with medical understanding about their disease. So activated patients perform more protective, risk-reducing behaviors. Protective risk-reducing behaviors, they avoid health-damaging behaviors, they're satisfied with their clinical interactions, and they have more out-of-office contact with providers. They also follow their plans more closely, right? Because they have been activated, they've been empowered, they understand what's going on. So think about your positive experiences with providers. Take some positive experiences might be that they took time to explain things to you, they contextualize things. They acknowledged your feelings and your uncertainty. They showed empathy that they cared. They gave you time to explain your thoughts and feelings. And they shared general personal information. Maybe that's what the doctors did. Again, this is from a former class. These are the answers they gave, but I would assume that yours are very similar. And with patient-provider communication, some of the negative experiences might rely on they were asked targeted or judgmental questions. Physicians made assumptions. They didn't take the time with you. They acted cold. And they rejected decisions or requests for tests. I don't know what's going on, but you seem fine. All right, so we've got one more patient-provider communication, and I will start that in the next video, so I'll see you then.